Today is the first of a three-part series on the important topic of trauma-informed care and services for immigrant families, as I mentioned. The interest generated by this topic and the speakers, as measured by those registered, has been just remarkable. I want to thank all of the many people that contributed to bringing this event together today. There was a lot of behind-the-scene activities to make this possible. Before we begin, I want to review a few housekeeping items. As you can see on the screen, please be aware that we are recording this session. All attendees are muted and cannot use their cameras. These functions are limited to the speakers only. Closed captioning is active. We're happy to offer that. We have two interactive activities, brief polls. Please participate when the time comes. If you have technical difficulties, please send a message at the Q&A function. Type both your questions and comments in the Zoom chat. If everyone is believed to misuse the chat function, you may be removed from the session. And allow me to review how we have organized today's session. We started by reviewing housekeeping items. We will move on to hear opening remarks. Then our keynote speaker will set the stage for this three-part symposium and today's discussion. We will share our first poll and ask that attendees participate. This will be followed by panelists, presentations, and a moderated discussion. Some of the topics and questions posted at the time of registration will be addressed during this discussion. Then we will take a quick break. After the break, we will share a second poll in the chat box. Again, we hope you will participate. This will be followed by an open question and answer session. This is your time as attendees to enter questions for the speakers. Please use the chat box to post questions. We will end today's session with closing remarks. So to start us off, I would like to share a short film about a UC Davis DACA medical student.
I would wake up every morning and look at the news to see if there was any updates regarding DACA. Having to worry about your future, having to think of a plan A, plan B, plan Z. The fears and anxieties that I experience as a DACA student are many. I feel like I'm on a constant struggle for survival. Every day I wake up not knowing whether DACA will get taken away.
They are constantly under lots of stress, fear, uncertainty, anxiety, depression. In every step, there are obstacles and barriers.
There were many times, many people that told me that I could not get to medical school. I dropped out of school halfway through my third year of my undergraduate career because I simply ran out of money and I could not pay for school. Mi nombre es Edgar. Yo soy un estudiante de segundo año en la Escuela de Medicina de UC Davis. I have to worry about whether I'll be able to continue medical school moving forward. I worry about my future in residency. If DACA gets taken away, I cannot become a doctor and I cannot fulfill my dream of going back to my community and serving the underserved. I worry about that every day.
In spite of putting themselves at risk, they are still willing to be out there because they know that that is the right thing to do. And it's something that I think we ought to admire.
Every DACA story is a story of resiliency, and at the end of the day, no matter what happens, knowledge is power and no one can take that away from me.
This is an inspirational and powerful story that Edgar Velasquez shared with us. And it highlights how policies that affected him with his education and future goals are becoming a doctor and going back to serve his community. I would like to ask if we can go to Dr. Lewarsky's video. And if I just can say one thing very quickly about him, Dr. Lewarsky, David Lewarsky, is the Vice Chancellor of Human Health Sciences and Chief Executive Officer for UC Davis Health. He oversees UC Davis Health's academic, research, and clinical programs, including the School of Medicine, the Betty Irene Moore School of Nursing, the 100-member physician practice group, and UC Davis Medical Center, which is a 625-bed acute care hospital. And, you know, Dr. Lewarsky just completed 2 years at UC Davis, and he literally has re-energized the health system and recommitted the organization to expanding care for the underserved, earning UC Davis, reputation among other health systems about really tending to those who are in need. So with that, please play the video.
Hi, I'm Dr. David Lewarsky, and it's an honor to be able to address this audience remotely about trauma-informed care for immigrants and their families. We're at a time today where perhaps nothing is more important to talk about than our commitment to underserved communities. And part of those underserved communities are the immigrant communities among us. Just like everybody else, they love their children the way I love my children. They love their parents the way you love your parents. Everybody deserves care, and health care especially. So as we talk about what the federal government has done recently that negatively impacts our immigrant communities, I'd like to spend a few minutes talking about specifically how it negatively impacts the health and well-being of our immigrant communities. The first and most important issue is the idea that if an immigrant seeks help, if they need food stamps or Medicaid or any type of help, that somehow or other that makes them less worthy of American citizenship. This idea of ever having been a public charge, disqualifying people from seeking needed medical care, is terribly misguided in general, but almost a crime during the days of pandemic. It is exactly these communities who have decreased resources, who live paycheck to paycheck, and who need some help with health care during an infectious disease event like this, who we should be welcoming into our clinics and into our hospitals, as UC Davis Health does, without them having any fear that they will somehow or other be negatively viewed by the US federal government. If the disease spreads within their community, it spreads within our community because we are all one community. So it is critically important that we seek to overturn this public charge issue as soon as possible on behalf of the public health of the entire United States of America. The second thing I'd like to talk about has been the misguided efforts at the federal level around DACA. There's no society in the world that calls itself modern or educated or well-meaning that takes the actions of a parent and tries to prosecute children for what is nothing that they brought on themselves. The children of immigrants who arrived with immigrant families who might not have crossed the border legally, they did nothing wrong. They just want an education and a life to continue that they've known for their entire lives. We have an obligation to those children. We have an obligation for humanity not to turn those children away. And when they fear being deported or having their parents deported, when they seek health care or other services, again, we do a great disservice to both our community and their community. We are one community. Third, but also related, is this idea that there's increased enforcement of deportations. While a coherent federal approach to immigrants is a great idea, the application of increased deportations at the federal level is a horrendous idea. It causes people to live in fear. It causes people to hide. It causes people not to get the services that they and their loved ones and their family need because of fear of being uncovered and sent back to usually what is an unsafe environment. Again, we have to work together to ameliorate and alleviate these incredible stresses on our immigrant communities. Last but not least, I want to touch on the overwhelmingly negative impact of health inequities in underserved communities, especially immigrant communities, that have surrounded this pandemic. It has highlighted the fact that social determinants of health, the availability of uncrowded housing, of food, of healthy food, of transportation, of testing facilities in their communities, and in clinics in their communities, and in insurance in their communities, from which they are not deterred, has really resulted in a terrible inequity in health outcomes from COVID-19. It isn't that it is only COVID-19, it is in many other health areas where outcomes are worse in our immigrant communities and underserved communities. So we have a call to arms and a call to action, because COVID-19 has incredibly highlighted how worse off these communities are in terms of their health care when such a crisis occurs. The sad thing is there's an ongoing crisis every day in disparities in health outcomes, and UC Davis Health is 100% committed to erasing those disparities as part of our social mission and educational mission and clinical care mission here in Northern California. I want to thank you for this invitation to speak. While I'm not able to join you personally, I can assure you my heart is with you in this room.
Yes, we are very thankful to Dr. Lewarsky for those, for me, inspiring words, and to hear clearly what is the position that the UC Davis Health has in this important topic. And we, indeed are committed to achieving health equity and committed to reduce disparities, in health access and also in utilization of services. I'm going to introduce now Dr. Sandra Hernandez. Dr. Hernandez is president and CEO of the California Healthcare Foundation. Prior to joining CHCF, Dr. Hernandez was CEO of the San Francisco Foundation, which she led for 16 years. She previously served as Director of Public Health for the City and County of San Francisco. She also co-chaired San Francisco Universal Healthcare Council, which designed Healthy San Francisco. It was the first time a local government in the US attempted to provide healthcare for all of its constituents. In February of 2018, Dr. Hernandez was appointed by Governor Jerry Brown to the Covered California Board of Directors. In December 2019, she was appointed by Governor Newsom to the Healthy California for All commissions, for a California for All Commission, which is charged with developing a plan to help California achieve a healthcare delivery system that provides coverage and access through a unified financing system. She serves on the UC Regents Health Services Committee and the UC San Diego Chancellor's Health Advisory Board. Dr. Hernandez practiced at the San Francisco General Hospital in the HIV/AIDS clinic from 1984 to 2016, and was an assistant clinical professor at the UCSF School of Medicine.
Thank you, Sergio. Thank you very much for that introduction. Welcome everybody. Good afternoon. It's an incredible honor to offer a few remarks this morning in advance of what I think you'll find to be an amazing symposium. Important, I think, just to step back for a moment and recognize that immigrants who come to this country come for many different reasons, but many of them come due to rampant gang activity, to gang violence, to sexual violence, really to impunity of all kinds of abuses. They face violence in transit, in perilous journeys to get here. And then once they get here, they, of course, are subject to the policies of our government and our administration. And at this moment in time, as we think about COVID-19 and what it is showing in our failures of public health, and really what it's also showing is how vulnerable immigrants are to all kinds of public health contagions, but also to the trauma associated with policies such as public charge, such as ICE raids in workplaces and in schools and in community centers. Really, the story that Edgar shared of the resilience of our DACA residents is a story of resilience. And I think what the purpose of our symposium series that the UC Davis Center for Reducing Health Disparities is trying to do is talk about how important it is to understand this toxic stress and the combined traumas that our immigrant families in California and really throughout the US are facing today. So it is an incredible honor that we have at California Healthcare Foundation to help support this work. I really want to acknowledge Dr. Sergio Aguilar Garcias for his leadership, his entire team, even before COVID-19 was very early on convening conversations about the impact of these various policies on immigrant families and communities throughout our country. So with that, it is also my distinct honor to introduce you today to our keynote speaker, Dr. Demetrios Papadimitriou from the Migration Policy Institute. He is one of the foremost thought leaders on public policy related to migrants, immigrants, and refugees here in the US and globally. He's been an advisor to numerous presidential administrations in the US, to governments in the European Union, and to international organizations such as the World Economic Forum and Organization of Economic and Community Development. One of his most recent publications calls for a new social contract for countries in this age of global migration to counter the fear-based nativism that we're experiencing here in the US and throughout Europe. The new social contract would focus more on economic, social, and political integration and inclusion rather than on just who and how many and where we're going to allow people to stay. So with that, let me give it over to you, Dr. Papadimitriou. I think all of our participants will enjoy hearing your experience and your remarks. Over to you.
Thank you very much, Sandra, for this introduction and the kind remarks. And I'd like to thank Sergio, of course, and his team for all this effort that they have put into making all this possible. 3 virtual events in a relatively short period of time is certainly not an easy matter, and congratulations on that. I also want to say hello to my fellow panelists and to greet all of you in the audience. I will try to do 3 things. We'll see how far time will take me. The first one is that I will discuss the context in which the public charge rule and its implementation must be understood. The second I will discuss the rule and at least one of its deeply associated policies, the Affidavit of Support. I'll explain what that is when I get there. I will say a few things about what the rule says, what it is, its origins and its goals, how it compares to the last rule on this issue, because there is nothing new under the sun when it comes to US immigration policy, as you will find out. And also that criteria that government agents, meaning the people who issue visas abroad, as well as the adjudicators in the United States from the USCIS, the criteria they use in making judgments as to whether someone is likely to have to rely on government benefits if they come to the United States or if they change their status to a permanent status, and make a decision accordingly. And I will also say a few things about the public charge rule's likely impacts, both actual and at least one step removed, the chilling effects of all this. And then, assuming that I have time, I'd like to gaze a bit into the future, what may happen next January and beyond. And apologies to all before I start, or as I'm getting ready to start, I have no good news for anyone. This is a difficult issue, and I am afraid that we're going to have to sort of deal with the consequences, while at the same time trying to understand what the government is doing and how we may protect ourselves, those who need to protect themselves. This way they don't fall into a place, they don't go into a place they don't want to go to. I think the first statement that I would like to start with is that this administration has engaged in a fundamental remaking of the US immigration system. And it is important to understand that the US immigration system is indeed a system that has an awful lot of interrelated pieces. And this administration seems to have found the key, the magic sword that allows it to go into the black box. Every system has a black box, into the black box, and work from there in order to move forward with its policy objectives. The changes that the administration has made are both broad and sweeping, but at the same time, and this is really a remarkable thing that my colleagues at the Migration Policy Institute, particularly Sarah Pearson and Jessica, have really identified and have made it obvious for everyone to see. And I would urge you that when that report comes out in the next week or so, you should look at it in order to get a sense of how massive the effect that the Trump administration has had on immigration really is. So what the administration is trying to do is the president is trying to deliver on all the promises that he made. He made a lot of promises, and many of these promises focused on immigration. And he's doing that. He's doing that methodically, and he's doing that primarily via executive orders and actions. And again, because this administration, unlike previous administrations, understands the interlocking parts of the immigration system, they have been particularly effective. And you would say, what about Congress? Well, Congress has, in a sense, resigned to simply look from the outside, take shots at what it is that the administration is doing, and doing nothing about trying to move forward with the kind of necessary policy reforms, legislative reforms that the United States immigration system has needed for certainly almost 30 years since either 1990 or 1996, with 1996 being the last year that we had a fairly deep immigration reform. So what has the administration done? It has, and this is in no particular order, it has pressured the immigration courts to streamline their decisions and increase the pace of making these decisions. Just to give you a sense of the numbers, between 2018 and 2019, there was a 40% increase in cases, in deciding cases, and a nearly 50% increase in deportations, removals, etc. The second thing is that it has systematically narrowed access to humanitarian relief. And we see this every day, particularly you in California. I know Davis is not at the border, but we see all this happening every day in the southern border. The third thing we also read about, and maybe we see it among friends and family, the refugee admissions have become practically eviscerated. They stand roughly, both last year and this year, roughly at about, let's say, 20%, between 20% and 25% where they were in 2016. And enforcement has been increased dramatically across the board. Finally, we see that legal immigration, both permanent and temporary, has been reduced on average by about 17% each in the past, since again 2016. I used 2016 because that was the last year of the Obama administration. So the administration has also used the pandemic as an opportunity to basically complete big chunks of its agenda by using public health emergency powers that the president has had since 1944. As I said earlier, there is nothing that is brand new in many of these things, and also using the economic crisis as an opportunity to try to reduce all forms of immigration. Specifically with regard to the border again, and the asylum at the southern border has been effectively ended. And as I said earlier, visas, both temporary work visas, but also visas for permanent residency, have been reduced and are likely to continue to be reduced as this year progresses. And what is the administration's deep rationale? And here I'm speculating, so you will forgive me if I do so, and if you don't agree with me, you will ask me questions or feel free to challenge me in other ways. We know that just about everything that the administration has done has been challenged in court. And several of the various proclamations and executive actions and all these other kinds of means through which the administration is changing immigration policy, there's been quite a bit of pushback, but these pushbacks tend to be only temporary. At the end of the day, most of what the administration started to do, even if it has had to amend what it is that its actions actually were trying to accomplish, it has been able to accomplish it. So, moreover, and here is where the speculation gets a little deeper, the administration seems to not only not mind, but certainly to expect and to possibly argue that can even welcome some of these challenges to its authorities. And I say welcome in that the best way for people to understand, the voters of the Trump administration, the base of the Trump administration, the best way for them to understand how hard this president is trying to deliver on his promises is by seeing each one of those issues in the news, whether on television or in print, all the time. Is this perhaps perverse? Well, I don't know about that, but it's certainly politically savvy. And it is the only thing that the administration cares for, particularly at this time. It is its re-election. And in doing so, they have been trying to pursue all of these changes. So the political point is always front and center, including the point about the need, the importance of appointing judges at all levels that will support the president. The legal challenges take time to resolve, and in the meantime, some of the initiatives can be implemented. The administration has been willing to amend things, if most frequently at the margin. There is a chilling effect that goes beyond what the language of each proclamation or order actually says, and this is probably also, to a certain degree, intended. And to bring this back to the theme of these three symposia that we will have, the trauma that is at the center of this meeting will only deepen. And that's, I think, the context in which the public charge and its associated policies must be understood. So what is the public charge? It is an inadmissibility test that goes back to 1882. Since 1882, we have been trying, after legislation, to keep people who are paupers, who are not particularly educated, in other words, they are analphabets, and others who might become a burden to the US taxpayer, keep them out of the country. There is a long history, in other words, to all of these policies. And in addition to that, since the 1940s, there has been something that is called an Affidavit of Support. Some of you will know of it, whereby the sponsor of a family immigrant, primarily a family immigrant, takes the responsibility to support their relatives who come to join them and be responsible for expenses, for medical expenses and other kinds of things. This way, once more, they are not a burden to taxation, to the US taxpayer. And I misspoke, I said since the 1940s, actually, the affidavits of support go back to the 1930s. And once more, just in case we think that this is the only thing, this is the only administration that is trying to sort of toughen things up for immigrants, we only need to go back about 25 years to 1994 and 1996 under President Clinton, which re-emphasized the importance of those affidavits of support in a 1994 act, 1996 act that is unpronounceable. It's IRIRA, but it stands for Illegal Immigration Reform and Immigrant Responsibility Act. So, what is this administration trying to accomplish with the public charge rule? It is trying to make sure that people will not use benefits that are controlled by the Department of Agriculture, that they will not be able to use benefits that are controlled by the Department of Housing and Urban Development, subsidized housing specifically, that they will not be able to use disability benefits by using lack of English as one of the factors in the determination for such benefits. And of course, the administration is also pushing state agencies to actually seek reimbursement for expenses that immigrants incur in their states. What does the regulation say? It basically says that people who make decisions either about people's ability to come to the United States, both as an immigrant, by that I mean a green card holder, but also in some instances as a non-immigrant, a temporary migrant who may be coming here for a specific temporary purpose. And there are two agencies that are involved in this process. Anything that has to do with outside of the United States, the agency that is responsible for that is the Department of State. And in that case, visa officers at embassies and consulates abroad will have to make decisions about the admissibility or inadmissibility of an individual applicant. If you're already in the United States, the USCIS, the Immigration Benefits and agency in the United States, will have to make a decision as to whether someone can actually switch status and become a green card holder. And there are two standards here. Back in 1999, there was a rule that had the standard as being primarily, in other words, one is inadmissible to the United States if he is likely to be primarily dependent on government benefits, particularly two government benefits. The one has to do with long-term care that the government has to pay with. The other one, of course, with monetary cash benefits. The new standard has changed that, and it does two things. It focuses on the future completely, aggressively, and the standard becomes whether someone is more likely than not to use the new benefits that the administration wants people to be disqualified for. And those benefits cannot be used. The judgment that we have to make about the future use of benefits by an applicant is that they will be no more than 12 months in any 36-month period during which those benefits will be accessed by an individual. And the disqualifying benefits in the new standard, most forms of Medicaid, and there are some exceptions here, particularly exceptions that have to do with emergencies and pregnancies, of housing, subsidized housing, and of SNAP, Supplemental Nutrition Assistance Program. So this is, as I said earlier, a systematic attempt to make sure that people who come to the United States will not be a burden to American taxpayers. Now, there are exceptions to this, but the exceptions, which make a lot of sense, are essentially quite small. Refugees are exempt from this. Asylees are exempt from this. Members and families of armed force personnel are exempt from this, and there are very, very few other exemptions. In making the decisions, the government, whether it's abroad or whether it is here, they have to use 5 criteria. And I know this is too much of a detail, but I'm gonna say that and then stop on that in the discussion of the public charge. They have to look at age. The younger the person, the more likely they are to come to the United States and work. So younger is better than older. They look at health. If someone is likely to be using health benefits, that in a sense is a strike against you. They look at family status. How large is your household? Is this a household of 1 or 2 or 3 or 5? They look at education and skills, because the assumption is that better educated and skilled individuals will also be able to also be employed and do well in the United States. And they look at assets, resources, and finances. And here it gets quite sort of complicated. I won't walk you through that. But although the minimum standard is being able to have assets and resources that are 125% the poverty the federal poverty guidelines, we are on much safer grounds if that is 250% of the federal poverty guidelines. Once more, you see the logic there. The logic is to try to make sure that the people who come to the United States and gain permanent status, although some temporary statuses are also included, should be, as far as the administration is concerned, not just able to take care of themselves, but to be of that higher caliber that this president has been trying to introduce unsuccessfully in terms of legislation since pretty much the time that he became president. So, what is the likely impact of all this? Well, so far, and we have been enforcing something like that rule even before the rule became the rule and before the Supreme Court actually agreed that the administration could do that, which was only in February of this year. But the Department of State has been using, essentially similar standards since 2018. And from, the Department of State abroad issued 462,000 visas and denied 300,000 visas. But, and this is extremely important, only 21,000 of those were due to concerns about the individual, the applicant, becoming a public charge. Now, this is what the public charge rule is all about, etc. A lot of people are concerned that the rule is already having chilling effects. In other words, not only now that the rule is in full effect, although in many ways suspended during the pandemic, because the government has said that it will not count treatments and tests for COVID-19 against an individual. The fact is that it's clear that the law will discourage, and as I suggested before, perhaps intends to discourage migrants from accessing health, nutrition, housing, and other services. And although U.S. citizen children can have access to all of those things, a lot of parents are basically pulling them out of these support systems because they fear that there might be immigration consequences that they cannot think of, they cannot imagine down the road. That is a chilling effect. And there was a study by the Urban Institute published in December 2019 with a long survey, and I think it is important that perhaps you take a look at it, and you will see what high proportions of people have avoided non-cash benefits out of concern. So what about the future? There are two possible futures. By January, 21st of next year, we'll either have a repeat of the Trump administration, or we're going to have a Democratic administration. We know what is likely to happen if there's a continuation of the Trump administration. So I am not going to say anything about it. But the question is, can a Biden administration reverse all these things? Unfortunately, theoretically, it's certainly possible. But in reality, the same way that we got to where we are, piece by piece, with intense knowledge, not only about legislation, but also about rulemaking, about special instructions to different parts of different departments, because it involves the Department of Labor, Department of Agriculture, Department of State, SSA, et cetera, the Department of Health and Human Services. This idea that somehow we are going to be able to sort of fix all that is not realistic. It will take expertise, a lot of expertise, which really doesn't exist in the federal government, with the exception perhaps of DHS. It will take political will. It will take resources. It takes an awful lot of money to make these regulations, to fight things in court, et cetera, et cetera. And of course, the willingness to invest much political capital for extended periods of time. And the pandemic and its economic aftermath is likely to occupy most of the attention of this next administration.
Thank you so much, Dr. Papadimitriou. We really appreciate, your remarks with a little bit of looking at the crystal ball. And we have had a lot of several questions actually in the chat box. And what we are going to do, because of time, if you don't mind, is to wait more towards the end, and we will retake some of these questions when Ignatius Bao, moderates the panel. Is that okay?
Of course it is.
With that, can you go to the poll now? This is the activity that at the beginning of this symposium I told you about. And it is meant to be interactive with all of you who have joined us. So if you can please answer this question, we would appreciate it. The question is, before this symposium, have you heard about trauma as an issue when working with immigrants and immigrant families? Please respond now. We're gonna wait just a few more seconds, and then we'll show you the result of your answers. Yes, overwhelmingly, the answers are yes, that you have heard. Thank you for participating. Now, I would like to go to the next item in our agenda, and that is to introduce Ignatius Bao. Ignatius Bao is an independent consultant working with funders, health departments, and community-based organizations on both immigration and health policy issues. He worked for 10 years as an immigration attorney at the Lawyers Committee for Civil Rights of the San Francisco Bay Area, and was the founding board chairperson of the Northern California Coalition for Immigrant and Refugee Rights. He helped draft the 1989 San Francisco City of Refuge or Sanctuary Ordinance, and was on the statewide steering committee of Californians under Californians United Against Proposition 187. And I must say that it's been just a pleasure to work, shoulder to shoulder with Ignatius, who has played a remarkable, role in making this symposium possible. Ignatius is our moderator for the panel. Ignatius?
Thank you, Dr. Aguilar Garcias, and welcome everybody. We're really excited to have you join us in this conversation about trauma and immigrants and refugees. And so without further ado, I'm going to introduce our distinguished panel. First up is Dr. Luis Zayas, who is the Dean and Robert Lee Sutherland Chair of Mental Health and Social Policy at the Steve Hicks School of Social Work at the University of Texas, Austin. Dean Zayas has been a long-time champion of mental health services for immigrant and refugee families, and will share with us a little bit of his perspectives, particularly from the border region in Texas. Dr. Zayas?
Thank you very much, Ignatius. And I'm pleased to be here this afternoon with you to speak to you about how trauma is seen in immigrant and refugee children. My work has included studying U.S. citizen children whose parents have been deported, whether the children remained in the United States after their parents' deportation, or whether they joined their parents, in this case, most in Mexico. But today I want to focus primarily on the children who have come seeking asylum with their parents and the experience that they've had along the way, as well as the impact of immigration detention and other immigration enforcement actions on them and their parents. We have to step back as a background. When we talk about trauma and children who have come here seeking asylum with their parents, we have to speak about three levels of trauma, right? We have to talk about what happened to them during the time they were in their countries of origin and then leaving. The next set of traumas we would have to look at and assess are what happened to them along the way to get here as they trek through Mexico. And then, of course, there's what happens after they come here, particularly at the hands of the US government. And so it is those three layers that I think are important to look at when we're thinking about the accumulative trauma of being an asylum-seeking child. This is the drawing that was made for me by a then 7-year-old boy who I saw back in 2014 at a detention in South Texas called Carn City Detention Center. They quaintly call it Family Residential Center, but none of us would really want our families to be residing there. And so in this drawing, Danny is showing me what happened in his little town in Honduras that led his family to leave. At the bottom left, you'll see the bad guys, the gangs, the maras, who are shooting at birds and at people. Just above them is a dead man whose face has been shot away. And that's mi tío, my uncle, according to Danny. Over to the far right, at the bottom, you see his mother, who was really dismayed at the shooting of her brother, and his father, who is a single leg amputee and cannot do very much. At the top, you also see his abuelos, his grandparents, who are also aghast at what has happened to their child, Danny's uncle. And of course, look at the horrified son that a 7-year-old drew for me on that occasion back in 2014. And he tells me that he was 6 years old at the time that this happened, and that he saw his uncle's face disfigured and saw the teeth protruding from the back of his head. They immediately tried to leave, but they couldn't because father couldn't manage the terrain with on crutches, and he had to, after 2 attempts, stay back, told his wife, save our boys, take off. And I met Danny in the detention center. He had not heard from his father in about 6 months that he had been on the trek and then being held in detention. So that is just an idea of what happens prior to a child's departure in from their country. And then we talk about what happens during the migration through Mexico. One of the constant dangers and stresses is, who do we trust? The migrant can't really trust anybody because that vendor, that ice cream vendor over there might actually be in cahoots with the gang, or even with the police, who are not necessarily ethical folks in the process. They have to deal with coyotes, criminals, organized gangs. They see violence and death. They will see the remains of people who have died or have been killed along the way. And they suffer all sorts of indignities, imprisonment, deprivation, intimidation, physical abuse, sexual abuse, and all forms of depravity. And this comes again from the work that I've done both as a clinician on the border, as well as through the research I'm conducting now through studies funded by the National Institutes of Health. The third level of trauma is what happens to them when they arrive in the United States. In these pictures, you see what are the places that are called hieleras. They are places that the immigrants are held in for the first 72 hours when they arrive, after they've been apprehended by Customs and Border Protection. or the Immigration and Customs Enforcement. They're kept in these places for 72 hours. The air conditioning is kept at about 50, 55 degrees. Lights are on 24 hours. As I mentioned, they just arrived after a long trek. Their clothes are dirty, their bodies are sweaty, they want to shower, but they don't get anything for 72 hours. That is a chance to shower for 72 hours. And there's meager food, bologna between 2 slabs of bread. And as you'll see here, 1 toilet for all 30 or so people packed in there. Those half walls in the rear of the room are exposed bathrooms where they will have to do their business in the presence of 30 other people. From there, they go on to detention. Now, as Dr. Papa Demetrio has said, there have been many policies implemented over the years. But just in the time I've been working in evaluating children in detention and after their release, we've seen many more. We've seen the creation of the detention centers, in 2018, the zero tolerance and family separation policies that summer. And then in the fall of 2018, the threat of indefinite family detention, which is actually becoming a reality. Families are being held much longer than they should. So even between January 2017 and June 2020, there have been 50 major executive orders, policies, and court decisions. And just in the time since COVID-19, 48 policy changes. Some of them temporary and necessary because we want to prevent the spread of COVID-19. Some of them are reasonable, but you don't know how long they're going to be imposed. And then many others are used as a pretext for dramatic immigration restrictions. And I think this is the kind of trauma that our young people are coming to and experiencing. And we, as those working with this population, have also had a level of secondary trauma as a result. And I recommend this report here by the Decisions for Human Rights, because it really does talk about the long-term effects of family separation and detention. When we talk about detention, we're talking about two threats, okay, in detention. One of them has to do with deprivation. Deprivation during detention is really the absence for children of expectable, developmentally appropriate and expectable environmental inputs and experiences. Riding your bike, going to school, joining your family at church, going to Walmart and shopping. When you're in detention, all of that is gone. Then there's also the persistent threat by guards and other staff on the child. And we're talking about the ongoing experience that threatens the child's sense of psychological security, as well as their physical integrity. Now, they may be in detention and they may not be harmed, but they don't know that. The idea is that many of these prison guards are threatening children and scaring them off. Now, in this audience, most of you will have heard about adverse childhood experiences, ACEs, and we know that those shape the development of the brain, the trajectories and the wiring and the architecture of the brain. And when they're piled up one on top of the other over time, they develop a chronicity to them and have greater impairments in the psychological, social, emotional, and other functioning of children. So if you hear about I've just gotten the message that I'm already behind time. The trajectories of their development, that we can see how the ACEs will appear. And then, of course, detention affects families. Let's go to the next slide, please. I want to talk specifically about what happens to children's attachment in detention and during family separation. We know that attachment is the fundamental human bond between child and parent. And we also know that when there's a secure attachment, the child shows confidence and joyful reunion and interaction with their parents. You know, those of you who have been parents, babysitters, uncles, grandparents as well, you know that your child is securely attached. When they run to you into your arms and they feel good. And that results in good emotional, behavioral, cognitive, and social outcomes. But when there aren't secure attachments, we might see some problematic reactions. One of them is what we call avoidance. When the child expects the rejection from the parent upon reunion, and they avoid the parent rather than seeking proximity And they stay away because they want to reduce the chance of conflict or the possibility of rejection yet again by their parents. Or they may demonstrate more ambivalent behavior. The child is really uncertain of the parent's response to them. And the child then begins to display this passive or angry, resistant behavior when the parent responds to them. And the child, again, is ambivalent and not comforted by the parent. Let me show you this video of an example of a child who is demonstrating insecure attachment reaction. He's reuniting with his mother for the first time after 3 months. He was separated at the border from his parents, and he and his father went in one direction. The mother and his baby sister left for another direction. And then once he and his father arrived at their locations, they were separated additionally. But then they were reunited after 3 months to be with the mom. Now, I want you to watch this video carefully. Look at what Sammy does. You'll hear the mother, but look at what Sammy's behavior is saying. He's expecting her rejection, and he really does avoid her. Video, please.
Yo soy tu mami, papi. Yo soy tu mami. Dime. ¿Verdad que tiene mismo?
Pause the video. Now, you saw Sammy. He didn't want to talk to his mom. She's trying to hold him, and he's drawing away after 3 months of separation. A securely attached child would be wanting to hold on to mom for safety and comfort, but he goes away. He then walks towards his father, and for a second there, when I first saw this, I thought, well, maybe he's reaching for the security of his father. But no, he goes between the legs and then continues on. Please continue the video.
Yo me vine por ti, mi amor. Dime. Papi, vete, mi amor. Yo me vine por ti. Mi hijo está traumado, bebé.
This is a tragic, result of a family separation policy that was inflicted on people in 2018 by the Trump administration. You knew the outcry that followed afterwards, and so it was discontinued, although there's still evidence that children are being separated. Notice how dad holds on to the baby girl he hasn't seen in 3 months. He is just overwhelmed and needs to hold on to her. In the next case, we see an ambivalent reaction to the separation. And this is a boy who's been, in the shelter with his mother, that is now. They had been in detention, they were then separated, and they were now reunited. And here we see that ambivalence, where he's not really sure about her affection. Does she love him? Does she not? Will she protect him? Will she not? And then he also berates her and in the process, because his attachment has now been disturbed. He's angry, he's resistant. Video, please.
Toda esta separación fue muy larga, mi hijo ya ha cambiado mucho. Con tanto trauma. Ya no quiero ser tu hijo, ya no soy tu hijo, me dijo.
So, ladies and gentlemen, this is how social policy, when it burrows down to the core unit of our society, the parent-child interaction, this is what happens. Next slide, please. I'll just end on what we need to do. Besides changing policy, which will take a long time to disassemble, as Dr. Papadimitriou mentioned, our young people and their families need medical care. I think we really need to attend to their psychosocial assessment and look at what what will happen to them after this detention and possible separation. We could think about the possibility of a reactive attachment disorder when a child, which happens when a child is suddenly separated, neglected, perhaps sudden and repeated changes in the care of their providers, and they manifest inhibited behavior, emotionally withdrawn behavior towards the parent, something like we have seen in both of these videos, and very limited positive affect with the parents. And then these episodes of irritability and sadness or fearfulness. That's what happened in the second video. That boy, you saw him earlier in the video, you didn't, but the longer video shows him playing with his mother. But at the moment that there's some problem, some conflict between him and his mother, it triggers the ambivalent attachment reaction. As clinicians, we need to think about how do we bring parents and children together. We have to educate parents. This is what happens. Let us explain what happened to your child and why this behavior or her behavior, so that we take any of the guilt off of the parents and we explain that their child are reacting to the damage that was done by certain immigration practices. And then we have to engage in how do we repair that parent-child relationship. In the case of Sammy, the first boy, how do we work with that mother to have her not chase after Sammy, but be there as a comforting source that he can return to and gradually come together? Or in the other boy, who can learn to trust his mother fully again. Again, we have to consider that the trauma that has been caused by detention, separation, the migration process will affect their learning, and therefore good educational assessments and interventions are necessary. And I think we've got to do what we can to integrate them into our social settings, into our community, schools, churches, after-school activities, taking them out, riding bikes, being alone with friends, and doing what normal kids should be doing. Thank you very much, and I'm happy to answer questions when we get to that time. Thank you.
Thank you, Dr. Zayas. We understand that this is hard for us to watch, and for those of us who have seen some of this before, it brings back those kinds of memories from 2018. But I also think it's really important that we ground this in the reality of what the immigrant families were experiencing in this most extreme of the policies, but also every day in their lives. I'm going to turn now to our next speaker. Samantha Artiga is the director of the Disparities Policy Project and the associate director of the program on Medicaid and the uninsured at the Kaiser J Family Foundation. Ms. Artiga has done a lot of research and work with community-based organizations to really highlight the impact of many of these policies, particularly the public charge policy, on immigrant families. So Ms. Artiga?
Great, thank you. Thank you so much for having me here today. I feel really honored to be part of this conversation. A lot of the topics that are included in my presentation have already been touched on, so I'm going to try and move quickly through some of those. For those of you who are not familiar with my organization, the Kaiser Family Foundation, we're a nonprofit organization that produces health policy research and analysis focused on the biggest health issues affecting our nation. All our information and research is available publicly through our website at www.kff.org. So please feel free to search through the materials we have available there. Next slide. So I really just want to start again by providing the framework of just how much pressure is affecting immigrant families today due to the shifting immigration policy environment. And we heard some of this up front, but really there are just such a broad array of changes that have been implemented under the Trump administration through different authorities. I think even for us who are experts, it is difficult to keep track of all these policies and who they affect. I can't only imagine how confusing and fearful it is for families. But really, if we look across these policies, we see three key themes. The first is really restricting who and how many people can come into the United States, enhancing immigration enforcement actions, and then really restricting access to public benefits. So I think as a family, across all these policy changes, we really feel those common themes. Next slide, please. At KFF, over the past several years, we really have engaged in a broad family of work that is designed to examine the impacts of these policy changes for both families and communities. This has included a series of focus groups and interviews with families, as well as discussions and interviews with a broad array of service providers across sectors. Much of that work was conducted in California, in particular with support from the Blue Shield of California Foundation. In addition to that work, we have also been doing analysis of the implications of the public charge rules, specifically for enrollment in Medicaid and CHIP and use of healthcare services. Next slide, please. And really across that body of work, we have just seen consistently that the shifting in policy environment has had really wide-ranging and significant impacts on both families and communities. One of the key themes that really stood out across all of this work is just the extent to which families have experienced significant increases in fear and uncertainty, and the extent to which that is really negatively affecting their health and well-being. And I'll actually start with the last bullet here. I think, we've been very focused on some of the issues affecting families who are recently transitioning into the country, but some of these feelings of fear and uncertainty extended to families who have been in the United States for decades, and they cross all different immigration statuses to include people who already have green cards. There's just a lot of uncertainty, confusion, fear that policies may continue to change in the future. And what we're seeing in terms of the impacts of those fears is that families are really making changes in their daily lives and routines. For example, spending less time outside the home, engaging less with their community. We've seen really sharp increases in mental health needs, including anxiety and depression, and in particular, really stark mental health needs among families where a family member may have been recently deported or detained. We're also seeing enhanced economic pressures, including increased difficulty affording food and other basic needs. Again, if a family member has been detained or deported and you lose a significant source of income for the family, but also if individuals are more fearful of working because of concerns about enhanced enforcement activity. And from the providers, we heard really significant concerns about the long-term consequences of this fear and anxiety for the health and well-being of children. Again, I think everyone on this call is familiar with the issues associated with toxic stress and the long-term impacts on both physical and mental health. Service providers also pointed to concerns about unrealized potential among youth. Next slide, please. We also heard that even though needs are increasing among families, at the same time, they're increasingly fearful of accessing programs and services. Families have a range of concerns about enrolling in programs and using services, not only related to public charge, also about potentially putting undocumented family members at risk, as well as concerns about having to pay back benefits. So there are multiple fears that affect families' use of services. In particular, though, the recent changes to public charge and housing assistance policy have really amplified those fears. And as was mentioned earlier, we already are beginning to see families begin to disenroll from or decline to enroll in programs, including Medicaid and CHIP. And I think it's really important to emphasize that those enrollment impacts extend far beyond the individuals and programs that are directly affected by those policy changes, that chilling effect, so that they include citizen children and other programs that are not named, for example, in the public charge rule. And providers have really expressed, again, concern about the health and economic impacts of that decreased program use. I think the quote here in particular about pregnant women putting off care until later stages of their pregnancy and the concerns about those health impacts really underscores those types of concerns. Next slide, please. We've already covered a lot of what the details are in the public charge and admissibility rules, so I won't go over the details here, But again, one of the key expected impacts of the rule is that it will lead to decreased participation in Medicaid and other public programs broadly among immigrant families and their children beyond those directly affected by the rule. Next slide. And we did some analysis looking at how many Medicaid enrollees live in a household where there is a non-citizen or where the Medicaid enrollee is a non-citizen themselves. We expect that these are the families that would be at risk for experiencing increased fears that could contribute to disenrollment. Here you see that there are a total of 13.5 million Medicaid enrollees in these households. And if you look at different potential disenrollment scenarios, which draw on some previous experience related to policy changes, you could see that we, under a low disenrollment scenario, 2 million individuals could disenroll, but under a higher one, you're looking at close to 5 million disenrolling from the program. Next slide, please. And beyond those predictions and estimates of how many may disenroll, we also have data from community health centers that are already reporting families disenrolling or refusing to enroll in or renew their Medicaid coverage. Here you see from our survey of health centers in 2019, the share that reported some of their patients were refusing to enroll or disenrolling, as well as the share saying that patients were disenrolling or refusing to enroll their children in Medicaid. Next slide. And beyond those enrollment impacts, we also started observing some changes in healthcare use, with health centers reporting shares of their patients reducing seeking care, as well as reductions in care for children of immigrant patients. Next slide. And across the research that we did over the last few years, I think what we really heard was the growing needs in services for families, basic needs like food and housing, as well as major mental health needs, but that there are gaps in these services. For example, with many families not receiving counseling or mental health services despite interest in receiving those services, families really experiencing a lot of challenges finding affordable legal help and often going into significant debt to obtain legal help or going without representation. Families did identify some trusted resources that they still feel safe sharing information with, but capacity among those resources is limited. For example, they pointed to teachers in schools, churches and faith leaders, providers, and families also indicated that ethnic media continues to be a really important source of information for them about policy changes. Next slide, please. I want to make sure we touch on what providers are experiencing among all of this, because this does extend beyond families to their broader communities and the providers serving them. We similarly heard that service providers are really feeling increased pressures and strains, and also about secondary trauma and burnout among staff, which were a real concern among service provider organizations. At the same time they're facing increased need, they also are finding it more difficult and complex to provide support, especially legal support, because the policy environment is continually changing. Providers have tried to respond to growing needs in multiple ways. For example, by strengthening existing and developing new partnerships across sectors, trying to expand mental health capacity in other sectors, for example, increasing services and supports or mental health availability in schools, and really trying to identify and rely on trusted individuals and organizations to be the ones reaching out to families. Service providers also really emphasize the fact that state and local leadership and policies can really strengthen support and underpin a strong community response. Next slide. In terms of what they pointed to for the future as needs to help fill the remaining gaps, they really stress the importance of continuing to build cross-sector relationships and make them more sustainable over time. Over the long term, a real need to increase the supply of mental health and legal services providers, the need to meet the growing demands on nonprofits and local governments, particularly as families increasingly turn away from sources of federal support. Again, as families are turning away from those federal programs, they emphasize the importance of maintaining access to services, including healthcare, and continuing to really educate and inform families about policy changes to help them understand who is and who is not affected. They really pointed to the role that state and local leaders and philanthropy can play in helping to fill some of these needs, and also pointed to the importance of fostering leadership development within affected communities and really trying to build on the strengths and resiliency of immigrant families. Next slide. So to wrap up, I think, consistently what we saw across our research is that the shifting policy and political environment is really leading to increased fears and uncertainty that have far-reaching effects on families. We see mental health impacts such as stress, anxiety, depression, and trauma. We see increased financial challenges, and at the same time, these needs are growing. There's a reluctance among families to access assistance or services because of fears. Communities and service providers have really stepped up and tried to respond to growing family needs and challenges that are largely built around enhancing cross-sector coordination and trying to enhance services and supports, but there are still gaps that cannot be filled by those efforts. So looking ahead, they really stress the need to continue to strengthen those cross-sector relationships, take long-term steps to address those gaps in mental health and legal services, continue to provide sources of trusted information and education, and build on state and local leadership and philanthropy to support efforts, and again, to not forget the strength and resiliency of the communities that you are serving. And then I think just thinking about this all through the COVID lens, again, we're seeing that this fear and uncertainty may make families more reluctant to access testing and treatment. And at the same time, the financial challenges may make it more difficult for them to isolate or quarantine and increase the risk of exposure for the virus. So really all of these challenges are now just further amplified and exacerbated by the pandemic. And with that, I'll close, and I look forward to the questions and discussion.
Thanks, Ms. Artiga. So this is the challenge that we face that we're exactly talking about. Policy changes happen in real time. So many people have acknowledged in the chat that the Department of Homeland Security has just issued a new policy on the Deferred Action for Childhood Arrivals program, the DACA program, essentially saying they're not taking new applications, they're limiting renewals to 1 year, and they're not going to grant requests for advanced parole or travel outside of the US. So as we continue to digest this in real time, I'm going to turn to our final panelist, Mayra Alvarez, who is the president of the Children's Partnership. She's also an appointed member of the First Five California Commission and the California Mental Health Services Oversight and Accountability Commission. Ms. Alvarez.
Thank you, Ignatius, and thank you to Sergio and the entire team at UC Davis for the opportunity to join you all today. For those of you that don't know the Children's Partnership, I hope you get to know us. I have the honor of serving as president of the Children's Partnership. We're a statewide policy and advocacy organization specifically focused on child well-being. And our job is to first and foremost advocate for children and to ensure that their well-being is considered in the policy-making process. Much of our work in the 25 years that we've been in existence has focused on technology and healthcare access. And over the past few years, immigration has really emerged as an issue that is intricately connected to health and well-being for California's children. Next slide, please. So what I have the good fortune of doing is following my esteemed panelists and really bring it home to California, focusing on who our kids are. I'm going to begin by grounding us in that. Across the country, 1 in 4 children are part of an immigrant family. Yet in California, half of our 9 million children have at least one immigrant parent. So we as advocates, in thinking how we can best support the health and well-being of California's children, knew that we needed to consider how immigration was impacting every aspect of children's lives. Next slide, please. I want to pause for a moment because it's important to consider who it is that our immigrant families are and where they come from. We know that children in immigrant families are a key driver of US child population growth, but they're also a key driver of the increasing racial and ethnic diversity of our communities. Latin America, as most of the media demonstrates, continues to be the region of origin for the parents of the majority of children of immigrants in California as well as nationwide. About a quarter of parents of children in immigrant families are from Asia, and roughly 7 to 8% are from Africa. And what's interesting to note is that for African immigrants, this is a share that has almost doubled in the last 10 years. So as we work to collectively change the narrative on immigrants in this country and what we can do to better support immigrants in our communities, it's critical that we make clear the diversity of our immigrant community so that we can better address the intersectional nature of the challenges children in immigrant families face. Next slide, please. I'm not going to take too long on this slide. I just want to remind us again the federal climate of anti-immigrant efforts that this administration has really advanced in a number of different ways. We in California, the Children's Partnership, wondered what was happening in the state of California that may have pushed back against these federal actions, given our state leadership. Next slide, please. We know that over the last few years, and particularly the last couple of decades, there's been a marked shift in California and its sentiment towards immigrant communities. California has demonstrated a very different approach than the federal government, one focused on inclusion and community for immigrant families that's been advanced by multiple state leaders. The Attorney General has double digits in the lawsuits pushing back on anti-immigrant policies. We have a state legislature that has put forward multiple efforts to try and advance immigrant inclusion, thanks to the leadership of many of our immigrant serving organizations and community partners. The governor has put forward efforts to increase funding in mental health services for immigrant communities, as well as most recently in response to COVID-19 and this period of physical distancing, the governor's disaster relief assistance for immigrants program, a program that's implemented in partnership with community organizations to support undocumented immigrants. Our budget has reflected continued investment in coverage programs for immigrant communities, including many undocumented immigrants. And while we definitely have more to do, there is a clear understanding in California that immigrants are part of our communities. They are part of our families. They are part of what make California run. And because of that, we want to make sure we prioritize their well-being. So we at the Children's Partnership wondered, did that make a difference? Did it provide a buffer to what federal actions were doing? Was there protections in California that enabled immigrant communities to not be traumatized, to be able to lead healthier lives? Next slide, please. And so we had the opportunity to partner with our leading immigrant rights organization in California, the California Immigrant Policy Center, to create a multi-pronged research effort that tried to explore if California, in its state level policies that sought an inclusive agenda, if it was making a difference. We knew that as we heard from our health center partners in the community, our community partners, after school partner colleagues, and education leaders, that kids were continuing to be worried, families were paralyzed, and communities were in need of support. And we wanted to ensure that there was data that demonstrated that here in California. So in our partnership with CIPC, we started a project called Healthy Mind, Healthy Future, to explore these impacts specifically on children in immigrant families, and even more specifically, children in the interior. And I want to give credit to the many partners that enabled this project to come to life. Kidsdata.org, California Primary Care Association, a number of our immigrant serving organizations across the state, whose collaboration really truly made this project come to life. Next slide, please. So first, we did conduct a survey of over 150 providers in California in partnership with our California Primary Care Association, which is the association that represents community health centers across the state. That found that many children and families were experiencing increased health and mental health needs, while at the same time experiencing higher barriers to accessing care, and primarily due to fears of detention, deportation, family separation. 90% of providers reported seeing an increase in anxiety and fear amongst children. Among parents, 70% of the providers reported observing increased anxiety in doing everyday activities, like you've heard my fellow panelists talk about, everyday activities like taking their kids to school or the park for fear of immigration enforcement. And about 2/3 of the respondents observed an increase in families' concerns about enrolling in public programs like Medi-Cal, CalFresh, WIC. Next slide, please. To better understand how families were faring, we did a survey in partnership with Lake Research Partners that was distributed to immigrant parents across California. It was about 500 immigrant parents that responded to the survey that asked about their goals and challenges, recent behaviors and recent changes in behaviors and emotions, community safety. It was this was in 2018, so it was after 2017 and 2018. So it was after the election where we had seen and heard from our community partners that shift. A plurality of parents said that their immigration status and President Trump are the biggest barriers keeping them from meeting their personal goals, as well as the biggest obstacles to their children achieving their goals. Next slide. When we asked the survey in that previous year, immigrant parents reported that they did notice a change in their children's behavior. And of those that noticed the change, the majority believe that it was a result about what they had been hearing about immigration from President Trump, given this anti-immigrant rhetoric that was happening at the national level. Survey results also told us that parents believe their children are worried about their safety, they're stressed about their well-being of their family, and that they exhibit increased fear and anxiety, and that they believe their children are worried about their family or someone they know being separated due to detention or deportation. Next slide, please. When we asked about where are immigrant parents feeling comfortable, where do they feel safe, they told us that they feel safest in their homes. Their churches or places of worship also rose to the top as locations where they feel safe from immigration enforcement. However, it's important to note that 1 in 5 parents reported feeling unsafe no matter where they were in the community. Next slide, please. And in general, since the 2016 election, the majority of immigrant parents say they felt uncertainty about the future, stress, fear, frustration, and anxiety, that they felt those emotions more than they did before the election. And parents also, at least a third of the parents think that their children felt less hopeful and happy since the election. Next slide. So in addition to the survey, we worked with Lake Research to conduct focus groups of immigrant families, and we particularly focused on areas in the state that were away from urban centers to try and determine what it was that, suburban areas, rural areas, how that may have made a difference in the lives of immigrant communities. Immigrant parents in the focus groups expressed mixed emotions about the current direction of the country, with most expressing confusion and frustration about what was happening. But the focus groups also included children of immigrants, and what was shared really captured what Dr. Zayas and Ms. Artiga commented on in their presentations, that it's this daily doses of trauma-inducing activity that our children are facing on this daily basis. Uncertainty, fear, and frankly, an inability to simply exist. The Latino young man in Riverside captured it best when he said, "It's like hanging from a string that can be cut at any time." And when we're thinking about the fact that the trauma and the daily fear that these young people are experiencing, how that hinders their healthy development overall. Next slide, please. As the administration went on, we actually followed Kaiser Family Foundation's lead and really tried to estimate the impacts of the public charge regulation here in California, thinking through what would happen to the work that California had done to enroll more immigrant communities, more immigrant families into these public programs. So we partnered with kidsdata.org to do a state level analysis following what Ms. Artiga discussed with theirs. And we found that for CalFresh or SNAP, which is the food stamp program, up to an estimated 311,000 children would lose access to that program despite remaining eligible because of the chilling effect that public charge has ensued. And then up to an estimated 628,000 children would lose coverage from Medi-Cal, Medicaid CHIP, despite remaining eligible. And I want to pause on that one in particular, because California has done a tremendous job over the last couple of decades to frankly boast that we have the lowest uninsured rate of children in the country. And yet, because of these anti-immigrant actions, we're moving backwards. We're moving backwards. Children are dropping from the rolls because of the fear and the anxiety with enrolling in public programs and what it may do to their parents' immigration status, or what it may inflict in an application later on. The policy changes, while maybe this administration is trying to direct them at immigrant adults, are having far-reaching consequences for child health and well-being, and which highlights just how connected our families are and must be considered in policy development. Next slide. And finally, we also conducted focus groups around public charge and immigrant families, again, to better understand what was happening, particularly around Latino, Black, and API immigrant parents. And the concept of public charge, as we can expect, was familiar to most respondents, but many didn't know the exact details. Many had heard about word of mouth from friends, considered it mean-spirited, ruthless, and uncaring, and really identified that there was this anti-immigrant sentiment at the national level, that it would harm families and communities, reiterating what we know to be true, that there are negative impacts on access to critical health and social services for immigrant families. Next slide. So I will close by showing what we have termed as high-level recommendations in our work moving forward. In particular, really thinking through what can we do as individuals, as community members, as policymakers to better support children and immigrant families. Because we know much of this damage is already done. These policies, whether they're in proposed form or on hold because of COVID-19, really thinking through what is the damage that is happening to our families now as a result of the anti-immigrant climate that's been established. So really thinking first, how can we strengthen community safety so that families feel secure and supported? Laws like AB 699 that require welcoming environments in schools in California for immigrant families. How can we hold us accountable to implementation of laws like that? Investing in community-based approaches and a community-based workforce. This is particularly important, knowing that community members like promotoras, community health workers that have the trust of our communities, how can we sustain those workforces for the future to ensure that immigrants are better taken care of? Improving access, coordination, and integration of services. Ms. Artiga highlighted this, really thinking through how can we build and create community linkages between education and mental health services, between legal services and health centers. Really thinking through, there are safe spaces that immigrant families consider. How can we make sure that we're not adding additional barriers to them accessing the services they need to be successful? Building capacity of people that serve, of providers and educators that serve immigrant families, so that they know their rights, that they know what is and isn't true as far as legal protections for immigrant communities. And then finally, educating and engaging our communities about immigrant rights and building public will to take action, because it really is on all of us to ensure that we're creating a community, a state, a nation that reflects our values. Next slide, please. So finally, just really thinking through, immigration policy is a children's issue. It's multifaceted, and with COVID-19 and the impact on immigrant communities, it really highlights just how vulnerable many of our families are, but also how strong and resilient they are as well. And thinking through what we all together can do to support immigrant families, their children, and frankly, the economic future of all of us, given how connected the well-being of our children today is with the future for all of us tomorrow. Thank you.
Thank you so much, Ms. Alvarez. You shared so much with us in terms of some of the California response, as well as a vision for the future. So before we go to a quick round of questions for the panelists, I want to go back to Dr. Aguilar Garcias, if you wanted to say a few words.
Yes, thank you so much, Ignatius, and thank you to Dr. Zayas Ms. Artiga and also Ms. Alvarez for those, very important information that you provided. Just a brief, words about something that was posted in the chat. And just to let you know, thank you so much for posting your comments. Those are very important to us. And something that was posted, and that I counted three persons who commented about trigger warnings. And this is, as you know, heads up that the material may encounter this, may have distressing content, and just to let you know that thank you for sharing that information. I'm assuming that is in relationship to the very powerful video that Dr. Zayas presented. I personally was, impacted by it, and just to acknowledge that it is important for us to hear from you. If some of you this had, a strong impact and rekindle some experiences and feelings, we certainly were not intending to do that. However, I think that it's important to share with all of you that, it is important to present information in the way in which we are experiencing that. This is a useful feedback for the future two parts, the next two parts that we have. I'm an academician, and I know a little bit about the literature on trauma and also the impact on trauma victims that presenting material that may be triggering may have. And there is research about that, and some of the research that I have seen, it concludes, for example, a study that I know was done at Harvard, that trigger warnings did not reduce anxiety for those who participated. Some make the case that it is important for us in the public to be challenged or engaging with provocative, material. However, we really want to respect and want to acknowledge the comments that you provided. Thank you so much once again, and we will have a debriefing within our group, and we'll be responsive to the questions that you post. Please keep sending your comments. And with that, going back to you, Ignatius.
Thank you. So let me go back to Dr. Zayas with the first question. So I think you shared with us this broad frame, which I think is really helpful, of really this isn't just the experience of immigrants and refugees when they get to the United States, but it's this whole cycle of the violence that they've experienced in their home countries during transit and the migration process itself, particularly for women, I would note, where sexual abuse and rape is unfortunately also very commonplace. And so talk to us about how all of us can better understand sort of that cycle and cumulative trauma, so that it's not just the acute family separation or deportation event, but it's really the entire cycle of violence and trauma.
Kind of this longitudinal, we have to think about it as this longitudinal experience, right? Most of us, when we encounter stress, oftentimes it goes away or lingers a while, but it goes away and we learn to deal with it. But unimaginable for many of us to have been in a situation like the young boy Danny in the drawing was in his home country, where every day he saw violence and death, signs, indicating that if you speak up, you too will die. Teenage boys being recruited into the gangs, and girls being recruited for the purpose of being somebody's girlfriend in the gang. This is the constant element. So that's part of the piling on, if you will, that leads to the accumulation of trauma that we see in ACEs. That's been well studied. So it really is over time, and then the stacking up of all of these different experiences, and that's where we have the profound trauma. And then most of us, certainly many of the families I met, expected to have be treated well. They knew they were violating an international border, but they knew that the United States has laws to give people due process and generally treat people well. So, instead what they faced was a harsh environment, which added on to the trauma. And when we think about interventions, as we do with any client or patient, we begin to peel off the layers and deepen as they are able to, and as we as clinicians are able to. So that's how we need to look at it and understand it.
Great, thanks. So let me turn to Ms. Ortega. You had sort of at the end alluded to the fact that obviously with COVID-19, a lot of these stresses, especially the families who had been afraid to access healthcare, nutrition, other kinds of supports. Do you want to comment more on, or maybe give us a preview of any future looks at research that you might be doing to look at this particular effects of COVID-19 and the additional economic and other challenges that that's creating for immigrant families?
Well, I think, we've all heard a lot of the focus on the disparate impacts of COVID-19 for people of color broadly. And I think if we think about the specific impacts for immigrants, they really are facing an array of increased challenges and risks across the board. Due to increased financial challenges, they often are in a really tough situation of having to continue to go to work in order to meet basic needs like food and rent, while knowing that being at work is an increased risk of exposure. And I think there are even stories of individuals who are worried about exposure or potentially feeling symptoms who really don't have the flexibility to not go to work, because if they do not go to work, those basic needs will not be met. So that's one set of challenges there. You have on top of that increased challenges such as increased reliance on public transportation. That is also an increased exposure risk, potentially living in larger household sizes in smaller spaces, often multi-generational households. That increases risk of exposure. So you have these multifaceted ways in which risk for exposure is increased. And then you have on top of that increased challenges to accessing healthcare. So higher uninsured rates, less likelihood of having a usual source of care other than the emergency room. And then piled on top of that, you have this really enhanced fear of accessing any services or support. And at the same time, the sources of support and relief that have been provided by the federal government in response to COVID-19 exclude many immigrants from assistance. So they're left without a lot of the financial assistance that is available, have more limited access to some of the healthcare assistance that is available. And some of this extends to legal immigrants if we think about the fact that there are lawfully present immigrants who remain excluded from Medicaid and CHIP and food assistance and other programs. So really, I think what you're seeing is across an array of factors, increased challenges facing immigrant families that put them at increased risk of exposure and also make it more difficult to access services and support that they might need.
Great, thanks. So then turning to Ms. Alvarez, I know in some of the focus groups that you did, you also looked at populations other than Latino children and families. And I think, again, we want to broaden this conversation. There's certainly, unfortunately, with COVID-19, a lot of anti-Asian sentiment that has arisen. We are certainly conscious with the murder of George Floyd of the importance of anti-Black racism still pervasive in our structures in our society. And so there are definitely Black immigrants and refugees that are also doubly impacted by racism as well as xenophobia. So can you comment a little bit on maybe some of the findings that you found from diverse groups of immigrants and refugees?
Absolutely. I think, Ignatius, you hit it. The fact that we are talking about ways in which we can better support immigrant communities, it is a shared struggle across various ethnic backgrounds as far as immigrant communities themselves. And I think it gets lost in the narrative that we continually try to push back against. I think for many people across the country, the term immigrant is synonymous with Latino or Latinx communities, and really neglects the complexity of the immigrant community when it comes to API communities or Black immigrants. And even within those populations, the impacts of immigration and the journey of immigration, the experiences here, just how important that is. I think, as we consider the impacts of COVID-19 in particular, building on what Ms. Artiga said, we have to make sure that we're not continuing to consider opening our cities, opening our communities, our schools, our country on the backs of immigrant communities and on the backs of communities of color, because it really is the opportunity for me to work at home and order food and get things delivered is because most likely you have a person of color or an immigrant doing those low-paying jobs that are making things possible. And really recognizing that because of that, it really highlights the interconnectedness of these issues. And as we're facing a moral reckoning in our country around racial justice, immigration and the intersectional nature of these issues has to be considered. So as for example, Congress is debating the next package of relief for responding to COVID, how can we make sure that immigrant communities are front and center in that and thinking through, we wouldn't even be in this position if it wasn't for the work of immigrant families across the country. So making sure that everyone has access to healthcare, including emergency Medicaid, so that coronavirus testing and treatment is available. Particularly the economic relief that is available through congressional legislation, and how can mixed status families be there? Because when you're thinking about the kids of these families, they're overwhelmingly U.S. citizen children, and they're being left out because Congress has chosen to do that. But there are a number of other different ways as well. And right now, in thinking through how these issues are so interconnected will not only allow us to better serve children and families, but make our collective fight for immigration justice and racial justice that much stronger.
Great, thank you so much. And we're gonna go into the question and answer, so please go ahead and type in questions, but I will start with a few questions that already came in. If you also have any trauma-informed practices that you have used and want to share, that's also a great resource to be sharing with the other participants attending this symposium. So let me go back to Dr. Zayas with the first question. You talked a lot about the impact on children, and what we know from adverse childhood events work is that these kinds of traumatic experiences that children unfortunately experience have lifelong effects over the course of their life and their health. So do you want to comment a little bit about, if we understand some of these experiences as ACEs and as trauma, what impact that might have on these families over time?
Well, thank you. It's a lot of question there, Ignatius, but I'll try. I think we have to think that, again, this is not going to be a one-time fix for any of these children and their family. It's going to take time. Things will occur to them as they grow, whether they stay in the United States or are returned, whether they are become citizens. That trauma will be with them, and so I think it really will need to be worked on. both individually and through family therapy. But I also want to point out that it's the disruption in the family processes and the family systems that comes about from detention that we've got to look out for. In detention, and I visited these detention centers, there may be 4 families in one cell, and that each family, let's say, is a mom and 2 kids, and there's no privacy. So mothers cannot read their child a bedtime story or say their prayers at night, and make sure you include Tio Pepe or someone in your prayers. These sorts of rituals that are so important for family functioning are simply lost. Mothers do not cook for their children in detention. It's all regimented. They eat whatever is given to them by the cafeteria. The mothers no longer can discipline their children. That's done by the prison guards. And so you see what happens to families. And in the long run, that will get played out with families upon the release. And so we do need to help those family systems strengthen and reintegrate over time. And we do know that ACEs, chronic mental health issues and stresses affect our immune suppression systems. We know that ACEs leads to chronic illnesses which shorten our lifespan. So there's a lot of work to be done. And I think there are ways in our communities. I was watching the chat, and there are many organizations in California that are doing great work. And I think you're helping one another there by indicating what others are doing. One last point, though, I just want to point out that you, right in your backyard, so to speak, you have a hero. You have a hero in Judge Dolly G of the federal court in Los Angeles. She is a one-person, one-judge army fighting the federal government's attempts to continue to keep children in detention. And we really have to applaud her work and support the work that she's doing, holding the government's feet to the fire around how we treat these families. The number of injunctions she has issued and the number of times she has brought everyone back to the courtroom, the government as well as mostly the government, as well as the advocates, to come back and talk over and to try to find ways to end children's detention and family detention is really an effort. I just wanted to point out because she is my hero.
Ignatius, can I just add, in addition to the points Dr. Zayas makes about the experiences among families in detention, in the interviews we did with pediatricians who were serving children and families still in the community, we similarly heard a lot of concerns about toxic stress among children who were still in the community for a variety of reasons. Some of them were potentially having had an immediate family member detained or deported, but it wouldn't even necessarily require that to trigger an issue or concern about toxic stress. Again, going back to just like the fear, overwhelming and constant, of potentially losing a parent, coming home from school one day and the parent not being there. You know, we heard difficult stories about children sleeping over door thresholds so that they would make sure that when they wake up, their parents would be there. And then compounded by a lot of the increased economic stress and in particular, increased food insecurity among families. So all of that together, just to say, I think these issues extend more broadly beyond just what we're seeing in terms of the detention facilities.
Great, and I think one of the themes that we wanted to raise is that trauma can help us understand all these impacts on the community. Again, as Ms. Alvarez pointed out, oftentimes the individual family will have individuals with multiple immigration statuses, and so there's not like an undocumented family here and then a U.S. citizen family there. So all these different policies are going to impact these families and communities more broadly, the extended families in different ways. So let me ask.
May I just add, thank you very much, Samantha, for the addition. We're presently conducting a study of U.S. citizen children who are living in Mexico. The trauma doesn't end just because they're on the other side of the border. Sure, they're among extended kin network, but they don't, you know, they long for coming back home to what they see as home. So indeed, you know, my focus was on detention, but there's a huge group, DACA, you know, US citizen children, those in and out of detention, unaccompanied minors who have lost their parents or are seeking their parents. So you're right, it's vast.
So let me turn to Ms. Alvarez. We've talked a lot about families and obviously the importance of parents in this conversation, but the other place before COVID-19 at least was going to be teachers and folks in schools that had to both educate the children, but also understand the traumas that they were experiencing in their lives. So do you want to talk a little bit about the work that the Children's Partnership has done with school districts and really trying to educate both teachers and school officials about the needs of immigrant children?
Absolutely. So we are proud partners of a variety of education partners across the state, and because we know how essential schools and early learning centers are for the healthy development of children. It's where they spend the majority of their day. So ensuring that our schools and our early learning centers and the providers that are there, both teachers and other professionals, are best informed about immigration and its impact on the healthy development of students and young kids is particularly important. We have a proud partnership with Californians Together, the California Association of Bilingual Educators, and others to really support implementation of AB 699. For those of you that don't know, in 2018, California enacted a law that requires school districts to be safe and welcoming spaces for immigrant communities, immigrant children in particular. Really requiring them to pass a local policy, to educate their workforce about it. As you can imagine, implementation of that law is not as robust as we would like it to be. Out of our 1,100 school districts in the state of California, less than, it's about 10% that have actually done something to address AB 699. So it's us as advocates and community partners and education partners that are working to strengthen implementation of that law, not just for making sure that a law is enacted correctly, but frankly, in order to create the environments that children need to be successful. And that's part of what this conversation is about, is how is immigration and the understanding of immigration and its impact a responsibility for all of us? How can we support teachers and childcare providers and early learning providers with the right tools and resources to better serve children, to recognize a traumatized child, really not asking what's wrong with you, but what happened to you? What are the experiences you're undergoing that is making you act this way? Because as we know, there are disproportionate disciplinary practices amongst kids of color. So again, thinking about that context, thinking about the whole child framework allows us to better take care of our kids and support their learning environments and their healthy development overall.
So then let me turn to Ms. Artica. You had talked briefly about, which I think is a really important point, that as providers, whether we're healthcare providers or social service providers or educators, we're also in this milieu of these policies that may not directly affect us, but are affecting the immigrant families and individuals that we're serving. So that secondary trauma, the burnout of trying to deal with the stress, just the whole environment. So can you say a little bit more? We'll talk in part 2 much more about trauma-informed approaches and include how that impacts on provider systems and other systems of care, but just briefly to touch on this notion of secondary trauma as well.
Right. So one very consistent theme we did hear from across service providers that touched on, that represented different sectors. So we talked to healthcare providers, we talked to legal services providers, we talked to social services providers, community-based organizations. They all spoke to this issue of secondary trauma and burnout and stress. And really, I think it reflected several factors. One is just really the increased demands and needs for services. They were just working beyond their capacity. And that was leading to real stress and burnout. At the same time, many found it more challenging to do the work they've always done because policy continues to change at such a rapid pace. This was particularly true in the legal services sector, where it is just so hard, I think, to stay on top of the ongoing policy changes and to feel really confident in the services they're providing to their clients. So you have the increased need, you have the increased complexity of the services that you're trying to provide. And then on top of that is really the secondary trauma of many of the individuals in these organizations have shared experiences with the families that they're trying to serve. So just as today, many people remarked on how watching the videos and having some of this discussion was difficult for them because it was close to them in terms of experiences they have experienced themselves. I think that same issue is playing out in terms of service providers working in the community in terms of sharing histories of experiences, or in fact going through those similar experiences at the same time as the clients that they're trying to serve. So this was a really significant issue that was raised, again, consistently across service providers. And we heard about a range of ways organizations were trying to address this. But I think the takeaway is really recognizing it as a need and then prioritizing taking steps to try and address the challenges that arise from it.
Great, thank you. So my last question before we close is, let me go back to Dr. Papadimitriou and ask you, we've had this very rich conversation about trauma, and so maybe this is a little unfair, but because you've had such great experience talking to policymakers, to presidents, is trauma a framework that you think would resonate with them and help them understand the experiences of all these adverse policies? So is this a way that we can be more persuasive of helping some of our policymakers understand how bad some of these policies have been?
Thank you, Ignatius. And I think it probably can be. Trauma is going to become much larger than what it is that we've been talking about because of the pandemic. So, you know, many more services that are trying to address trauma are going to become essential if our country is to move forward and get out of these many holes that we have built for ourselves. But I also want to say a thing about, you know, how much I have learned from my colleagues. They're doing the work that's absolutely essential as we're trying to contend with all of these various forces that are coming at us. But as a realist, I also want to emphasize that we live in a deeply divided society. And during deep divisions, elections become much more consequential than regularly. 20 years ago, 25 years ago, 10 years ago, you could have a Democratic administration or a Republican administration, and sometimes the differences were almost non-existent when it came to our issues. Now, the differences are dramatic. So let's not forget that part of the responsibility that we all have is to sort of put our energy together also between, you know, after changing the way that, you know, the election will be fought and an outcome of the election that can make an enormous difference in how all people, particularly people of color, how we treat difference, how we deal with immigrants, and the attention to trauma will be addressed. And I think this is sort of like a parting comment that I would like to make, besides telling everyone how much I have learned since I'm not a trauma specialist or a health specialist. Thank you.
Thank you, and thank you to all our speakers and presenters. And let me turn it back to Dr. Hernandez.
Well, thank you, Ignatius, and really I want to echo what Dr. Papadimitriou just offered, which is what we've learned today and shared today. Perhaps Myra said it best. There's an intense interdependence of a whole set of issues that are being brought to bear by what Dr. Papademitrio described in his very sobering review of the, fundamental remaking of the U.S. immigration system in this country. One would have never imagined that by executive order, some 50 in the last year and a half alone, could create such enormous havoc, not just in our immigrant families, not just among children, but in our community and society at large. Important to as we close at least this session, reflect on maybe three big picture takeaways. One is Edgar's story. This is a young man. He's had a community of support. He's studying medicine at UC Davis under extraordinary circumstances, and yet remarkably focused and resilient. And really, we need the Edgars of the world to be able to provide the care and to be the backup for what others have described as really a workforce that is pretty burnt out in all the ways it's been trying to protect our vulnerable communities. Dr. Zayas, your really thoughtful overview of how these policies are manifesting in terms of adverse childhood experiences, and certainly the impact of separation on young children and their parents. As Sergio said, the videos were quite painful to watch, and yet so important, because those of us that do policy and work in this arena really do need to have our very close eyes on the real experiences that young people and parents are facing as a result of these immigration policies. So thank you for the work that you do, and for those videos that will sit with us as we recognize how important the work going forward is. Samantha, I want to just appreciate how much your work has called out the increase in mental health needs. Obviously, we're in a pandemic, and if I might be so bold as to say, we are losing the war on the pandemic. And part of the reason we're losing it is that we don't think of community and public health in a holistic way. I had a conversation 2 days or so ago with our Secretary of Health and Human Services, who was lamenting the challenges that we have in addressing the COVID epidemic and its disproportionate impact in our Latinx and our Black communities in California. And really, this is true all across the country. And I think it is incumbent on us, as we think about this pandemic, to recognize that none of the testing, contact tracing, isolation, and quarantine that needs to be done to get control of this pandemic can be done in such an extraordinary culture of fear. And all of our speakers have talked about what that has done in our communities, and I would argue is very much at play in terms of our management of this particular epidemic. Myra described daily doses of fear. It will take very bold public will to take actions. And so Dr. Papadimitrio's comment about elections mattering, notwithstanding his very sobering summary of how hard it will be to roll back many of these policies, elections do matter. And by the way, so does census matter. And there too, we didn't talk about it at length, but really important to know that that intersection is critical. That will be a 10-year repercussion if we undercount a community that is under the kind of fear and and really disenfranchisement from the resources that we need as an entire community. How will we count 40 million people in California while we're in modified shelter in place and have public charge and ICE raids and the like? So I think, Myra, in your comments about the intersectionality of these issues, you laid them out in a way, really looking at it from the eyes of children, but recognizing that really we're also looking at it as a generational issue for all of us as leaders in whatever capacity that we have. So I really want to thank all of the panelists. What we've heard today is that there is a layering on of toxic stress and trauma. And there needs to be a way to approach trauma in a way that heals our communities and allows us to implement much more inclusive policies in all the arenas that were discussed today. So with that, I know that this was part one of Trauma in Immigrant Families. There are 2 more segments scheduled to come on board. I again want to thank the Center for Reducing Health Disparities at UC Davis, Dr. Sergio Aguilar Garcias and his entire team. Ignatius, hats off to you for putting together a fantastic program today. And I hope that all of you who are joining us today will join us again for part 2 of the symposium. So with that, thank you again, all of the panelists, and I'll give it back to you, Sergio.
Well, thank you so much, Sandra, and to Dr. Papadimitriou. Dimitri, a wonderful presentation. We are so grateful to you. And the panelists as well. Thank you for participating. I think your presentations were really at the heart of what this topic is about. And Ignatius, masterful job moderating the sessions and ending on time, actually. And also to the team who behind the scenes, as I mentioned at the beginning, did so much work and, troubleshooted during the technical difficulties that we had. So thank you. And I hope that all the participants, all the attendees will join us again for the second part of this 3-part series. And we have something that we think is going to be an excellent symposium as well. And that is scheduled for, as you can see on the slide, on Tuesday, August 25th, at the same time. We invited to be the keynote speaker, Dr. Nadine Burke-Harris, the California Surgeon General, and also 3 fantastic panelists. And the focus is going to be on service providers and treatment for trauma-informed care to immigrant families. So we have Dr. Altaf Sari, who has done fantastic work in this area, to Quach, and Dr. Andres Chola, who are experts in trauma-informed care. And with that, can you pass the next slide? Just to follow up, all of you who register from part 1 will receive a follow-up email with the link to the video, also resources and links, and questions and answers follow-up. And with this, I'm so heartened by all the comments, all the questions, all the very thoughtful participation that you all had. Muchísimas gracias. Thank you. Merci. Obrigado. We'll see you in about a month. Thank you all.